CCH has been doing affordable housing for seniors for 55 years. The emphasis has always been on housing with supportive services. We have never ventured into any program with a medical component, but we are trying that now in Texas. We went to the city of Houston and said we need to rehab this older seniors property, and can the city give us any financial support? And the city has made a recent decision to throw all of its resources toward the homeless problem. They said if you can make part of your operations committed to serving homeless folks, then we can give you lots of money and lots of resources. So after several talks with the city and various agencies in Houston that do provide homeless support, we decided to take the leap and do that. So we've spent a year and a half putting together a financial package and an operations package that converts 140 units of HUD senior housing into continuing to be HUD senior housing, but that half the property will be committed to homeless folks, homeless seniors that need to get off the street and into safe, decent housing. So the building is full of HUD money and 100% Section 8. So we've had to blend homeless programs with HUD's programs, which for a long time was really awkward to do. But in recent years, HUD also has put a priority on the homeless issue. So it's been a gigantic learning curve for us, because every piece of the financing, every piece of the Section 8 with HUD, every piece of the building codes have all had to be modified to create a new package for us. Really a new package for us and a new package for a lot of the organizations around the country. So in Houston, we did partner then with a local group called Central Care to provide clinic type services to homeless folks. As a medical clinic, they have a complete battery of services there. Social workers on the staff, dental clinics, vision clinics, whatever it takes to help a homeless person stabilize their life and get back into mainstream society. As units turn over, as our previous clientele, seniors move out, then homeless folks will move in. So it may take 2 or 3 years to get up to 70 folks, 70 homeless folks. And they come into our building only after they've been screened through the city's programs and have been put on rehab programs and have had their life straightened out enough to be able to live in independent living housing and pay their rent on time and behave in a normal social setting in a way that will fit in with the rest of the property. The Enterprise Foundation is tracking permanent supportive housing all across the country. The Enterprise Foundation has several branch offices around the country and is working with several nonprofits that are willing to venture out there and try and do permanent supportive housing, but blended with the federal housing models. So they've asked to be involved in our development in Houston. They've given us a grant, and they want to see what it takes to do capacity building to try and allow us to do this and others to do the same thing. They are also tracking the national expenses associated with serving homeless people. A homeless person who's on the street and often visits the emergency room might cost the federal government and the Medicare system from $100,000 to $500,000 per year in medical care due to their daily visits to the emergency room. To put the person in permanent supportive housing with and a service coordinator and affordable rent, they then can lop off 90% of their cost to the Medicare system and to the federal government. So everybody's highly incentivized to make this program work. We don't have the background and capacity to run a medical clinic or to screen homeless folks before they move into our building. So we are doing this by partnering with several agencies in the city of Houston. The mayor has a special person in charge of homeless programs in Houston, and that person has been able to hook us up with qualified clinics, qualified social workers, qualified medical folks that can help instigate the parts and pieces of this program. For us, the part of the solution has been collaboration and partnerships. But those kind of partnerships is the only way that CCH will be able to pull this off from 2,000 miles away in a city where we've never done this type of thing. We hope to break ground in April of this year, probably take 14 months of construction, and have a giant ribbon cutting ceremony in the summer of 2017. I hope it'll be a fantastic program and a new model for the whole country.